Hello, and thank you for joining us for this special Gleaner Editors Forum on the coronavirus in Jamaica. I'm Damian Mitchell. So far, there have been 2 confirmed cases of the coronavirus in Jamaica. The first was a patient who recently arrived from the United Kingdom. The other is a United States Embassy employee who visited the United Kingdom, I beg your pardon, and is now back in Jamaica. Both are in isolation. We have today to discuss this issue of the coronavirus in Jamaica the Health Minister, Dr. Christopher Tufton, the Chief Medical Officer, Dr. Jacquiline McKenzie, the Permanent Secretary in the Ministry of Health and Wellness, Mr. Dunstan Bryan, and the Interim President of the National Parent Teachers Association of Jamaica, Mitsie Harris. Let's begin with you then, Dr. Tufton, in respect of the latest on the 2 patients who were in isolation.
Okay, so that may be better directed as a clinic to the clinician, the chief medical officer, but as far as I'm aware, having confirmed the cases, they are now being treated in accordance with the best practices that have been established to treat these cases, but maybe if the CMO wants to add to that.
Well, right now both patients remain stable.
Okay. Thank you very much. So then may I just open then, or allow you, Dr. Tufton, to begin with a minute or so in respect of a general.
So first of all, thank you very much for having us, and sorry to be late. The all of society approach to confronting the coronavirus is really the stage we're at now. We had anticipated that there was a strong possibility that the day would come when we would have had an imported case. The 3-prong approach has been, in the first instance, to delay the possibility of that imported case while we put systems in place to deal with the case if it comes, which is why border protection, border control, restrictions on travel was an initial major priority. Having now had an imported case, the focus is how you contain that case to minimize community spread, which is internal spread. And so we are treating those who have symptoms, firstly testing, then treating, isolation, tracing the persons that they have been in contact with to determine whether or not they have been impacted, and from there on refining the strategy or plans to deal with the possibility of community spread, which is very likely, because once you have an imported case, someone showing symptoms, the fact is everyone they come in contact with is a likely possibility of transfer. And those persons themselves will come in contact with others, so it can spread very quickly. So that's the sort of 3-prong approach. We're now in the 2nd to 3rd phase. Beyond that, it is about how you inform the public about their role and adding some policy variations for things like restricting movement, suspension of certain types of activities that would see persons congregating, hygiene and proper management of oneself and the environment. All of that now is the big phase, which is why a discussion such as this one is important.
Thank you very much, Doc. Let's then move to Dr. Bisasor McKenzie, the Chief Medical Officer in the Ministry of Health, for your 1 or 2 minutes opening comments.
Right. I think now that Jamaica has its first 2 confirmed imported cases, what we need to really now do is to prepare the population for what they are to expect in the next coming days, weeks. So we do expect that there will probably be more imported cases, and what we really now are looking out keenly for is for evidence of local transmission. Once it is that persons start transmitting from imported cases to now cases that are in the population, it means that there is an opportunity for wider spread. So the focus of the population has to really be how do they prevent transmission, and attention of course to infection prevention control measures, because we can stop and we can contain, but it must mean that everybody takes an active role in preventing that transmission. We also have to prepare our hospitals as to what it is that they are to expect, because right now the focus is that we isolate everybody because it's new. So, and there are few cases, so we isolate those persons, treat them and keep them separate from the population. However, things will change as that time goes by, and now we have community spread. When there are more cases in the population, our shift in how we manage patients is going to be away from keeping them in a little pocket, because we now have a larger amount of persons, so we now move to management of persons on wards. And then our focus will change to treatment of persons who require hospitalization in hospital and treatment of persons with mild symptoms at home. So the population must expect that change and prepare themselves for that change.
Thank you very much. Mr. Bryan, can we open to a minute or two?
So again, thank you for allowing us this opportunity to engage with your audience and your readers. And one of the main things that we need to focus on here at this point in time is the whole business of the business continuity plans for the private sector and even for non-private sector entities and the public sector. And that business continuity must now examine what are the requirements that the business needs to ensure that they are able to sustain their infrastructure. We also want organizations to pay keen attention to leave entitlement, especially when it comes on to persons as we go through the different phases of the epidemic. The leave entitlement for quarantine versus leave entitlement for sick leave. So persons who may need to be quarantined may need to be given special provisions. Now in the public sector, special leave will be granted for this purpose, but in the private sector, we are encouraging the private sector to examine those leave entitlements. The Ministry of Finance and the Public Service will also issue the instructions regarding that. The budget that has been prepared by the government, already we have received approval for $2 billion to be allocated for our health response. And as the Minister of Finance and the Public Service has indicated, a provision of $7 billion for contingency is also in place. And as you are aware, the ministry has prepared our plan and has costed that plan, and several of the actions necessary to implement the effectiveness and efficiency of the plan are on their way.
Several important issues that we will pick up on, among them that business continuity. Just today, Scotiabank is reporting that its New Kingston branch has been closed indefinitely because patient zero had made contact with some of the staff there, so we have some issues to pick up on there. But we also have with us Mrs. Mitsie Harris Dillon. We're happy to have you, the interim president of the National Parent Teachers Association. Your opening comments.
Thank you so much for having me here, representing the voice of our parents and our teachers as well. Some of the concerns that have presented themselves ever since the issue of the coronavirus came to light has been in respect of how soon it would have arrived here in Jamaica, which it has now. We have 2 confirmed cases. And some of the concerns that have arisen almost immediately out of that is concerns as it relates to possible closure of schools, suspension of activities by our PTAs in schools, prevention of the spread of the virus through communities, which of course, as adults, as parents, we all have the responsibility of ensuring that we contain this disease and find a way to reduce or eliminate it. Other concerns that have arisen are that the transportation sector that so many of us rely on, how is it that we will treat with the transmission of disease to our children going to school or from school, and also our adults who use our public transportation system? Is there any directives that will be issued on how we treat with that in terms of sanitization of those vehicles? Other concerns have to do with the transmission of information in a timely manner and the way in which it is transmitted, so that we can convey the information to our parents in a timely manner and assist them in monitoring the situations as they may arise and pointing them in the right direction.
Thank you very much, Mrs. Dillon. Dr. Tufton, let's pick up on that issue, because the matter of the closure of schools has been quite topical, certainly over the past 24 hours. At what point will you make that decision?
Okay, so it's a decision that the Cabinet of Jamaica would consider and take based on the advice of the technical team, the clinicians, and it is something though that has already been discussed. We had an extensive cabinet meeting yesterday addressing this issue, and the Prime Minister of course spoke at a press briefing that signaling the intention to close schools, but giving notice to parents so that they can begin to make some provisions, allowing the school management through the Ministry of Education to begin to look at alternative ways of transmitting knowledge, whether using technology or otherwise, so themselves completing a plan of action. However, from the risk profile perspective, the challenge, of course, with the virus is that it requires people-to-people, person-to-person contact. And the school environment, of course, a lot of that takes place on a daily basis. And while our young people are not as vulnerable to the virus, indeed, most of the young will have the virus and easily recover. They are major transmitters of the virus because of their activity, their active lifestyle. So we are at a stage now where we have 2 imported cases. The signal clearly would be the risk assessment around community transmission. And to the extent that community transmission is imminent or has taken place, it would be, to my mind, trigger the need for more aggressive closures, including schools.
Well, that's one of the questions which has come in from one of our followers on Instagram. Why are we essentially doing what the other countries have done? Wait until there is community spread before we impose.
So we are not, we are not. In fact, Jamaica has been seen, I think, on the global stage of being perhaps more aggressive than most. Indeed, you would have seen some of the challenges that we have had with the cruise shipping industry, which was because we imposed, beyond what was already established, certain restrictions in terms of monitoring passengers, because the tourism industry is big, as you know. We had established the quarantine arrangements and the restrictions of travel for certain countries, even before any other country was doing that. I mean, we started with China, as many countries did, but then we went on to 5 others and then added 3 others and are reviewing others. And in most recently, we have started to restrict certain types of activities. We have said for the next 2 weeks, no permits will be granted for events, and permits that have already been granted will be revoked. And of course, the major disappointment, I know, but necessary nevertheless, the suspension or the cancellation of champs, boys and girls champs. So
you think those are adequate measures in the meantime?
There is no foolproof system. There's always risks, because you can't do anything to get 100% protection. But nevertheless, we think that we have taken strong measures, and the government is prepared to take even stronger measures. And I suspect in the next day or 2, you will hear other measures that will be taken.
Dr. Bisasor, McKenzie, another question. What's the plan for basic schools? We have not heard much about basic schools.
Well, I think that the direction would have to come from the Ministry of Education. But our guidance right now is that all sick persons should stay home. That is a basic recommendation. And of course that all the necessary infection prevention measures that can take place within the schools are to take place. Encouragement of hand washing, making sure that water is available, that is most important. In terms of the direct advice, in terms of closure of these entities, that will be taken by the larger government and will not come necessarily from the Ministry of Health and Wellness.
Mr. Bryan, you spoke earlier about the issue of business continuity. What's the strategy for that?
So we have had several conversations with different stakeholders, one of which is the Private Sector Organization of Jamaica. And in every crisis, business continuity has to be a paramount in terms of your planning. In this particular situation, as you have heard, for example, with the cancellation of major gatherings and large-scale gatherings, there is a business that is underlining that. And how does that business respond to these changes in the regulations, and also respond to the changing dynamics of the epidemic as we go through it? So several things. How do staff members continue to be productive within a restricted environment? Do we begin to look at introducing more flexi work arrangements within our organizations? Do we introduce smart technology to enable organizations and staff to work remotely? How do we look at supply chain for producing the goods and services that we deliver, given what is happening in international market? How do we look at the experiences of our staff members and their health and their security within the workspace? How do we encourage and enforce social distancing within the organization? So when you look at the organization and the workspace, does it facilitate social distancing in terms of how close the cubicles are, how people engage with each other in the lunchrooms, all of those things? Now we're asking organizations to investigate and to review their plans in light of these changing dynamics.
I want to ask Mrs. Dillon, how is her organization engaging your own stakeholders? But before that, she had raised some questions. Among them, what is the plan for transit on the Jamaica Urban Transit Company buses? Dr. Tufton, you may be able to address
So there's a plan being implemented as it relates to public transport generally. First of all, once restrictions are imposed, we anticipate that less persons would be having a need to take public transport, and those restrictions have started. As they increase, you will see less numbers. Beyond that, though, the Minister of Transport and the rest of the cabinet have started to put in place some arrangements to ensure that we have sanitizers on our JUTC buses. We are preparing information to put on these vehicles so that persons can actually get information while they ride in terms of their own hygiene and how to protect and manage themselves. It's important too for persons to identify and self-declare if they have issues, but also for others who may be around persons who may not be as aware or alert to be guided around seeking attention if they're on a vehicle coughing, for example. Because one of the things that we're going to have to do, and the CMO referenced it a while ago, is that if you're not well, the advice without exception is that you must stay at home. Now, we're assuming that Jamaicans won't use it as an opportunity to dodge work. Some of us are smart that way. But generally speaking, it is going to be better for you to isolate yourself in your setting and treat yourself until you're better. If you're not well, stay home. And that applies to the work, to school, to everybody.
Thank you. So, Mrs. Harris Dillon, how is the National Parent Teachers Association seeking to engage its own members where the information is concerned?
Okay, one of the quickest and most reliable means so far outside of emailing, we have been using our social media platforms, particularly WhatsApp groups. We are divided into 6 regions as per how the Ministry of Education, Youth and Information is set up. And we communicate directly with our PTA presidents by region. We communicate with our regional executives, and we share information and disseminate right throughout, and those PTA presidents will in turn pass on that information to their parents in their own local PTAs via their own social media platforms. So it is very critical that as soon as information becomes available, it is filtered to us, because as soon as the questions come up, they are directed to us. Following up on what Minister just indicated, though, as an addition, is that not all employers seem to have started taking steps in terms of making provisions for their staff members in terms of sanitation and extra care like sanitizers and the whole hand washing ideas. There are some persons who have raised some concerns of when all employers will be advised or will actually take up the directive that has already been issued via the press statements and release, that they need to start implementing some of these measures.
Very well. Well, we're having some questions coming in from Instagram. This one may be directed best to Dr. Bisasor McKenzie. Daystar 1980 is asking, do we have to pay for these coronavirus tests?
No. Once a person is within the public health system, and this is a public health event, there is no private, all our private practitioners will fall into the public health reporting system, which means that within 24 hours of seeing a person suspecting, you must report. So immediately you're going to take some measures in terms of getting that person into a facility, and the reporting process continues, which eventually now leads to testing.
And here's another question which may be for you from KB Silhouette. Can it spread before the coughing stage?
We recognize a continuum whenever it comes to from a person being infected to a person displaying extreme symptoms, okay? So before coughing, you may have other symptoms. You may start having a fever. Once you start having some symptoms, it usually means that the virus is pretty much has multiplied and is there being shed within your system, and you're able to spread it to other persons. So it may turn out that the person start having a fever. They may not develop a cough or a sneeze, but they may have a little runny nose at this point. So those secretions will be able to spread the virus, okay? But the main mode of transmission is through symptomatic persons.
And you're remaining in the hot seat, Doc. The admin guru is asking, is it possible to get reinfected?
There was one case that was reported in international literature that says that there was a patient who was discharged from hospital and then found to have a positive test after. The scientists, though, who have investigated that situation have said that they don't believe that the person had cleared entirely. Okay, so right now we don't have any sound evidence to say that there would be reinfection of the person. However, there is a protocol in terms of the discharge of the person from a facility. In that, the protocol includes that the person must have 2 negative tests that is separated by a time period before they are discharged.
Here's another question. This one is on Twitter. Wayne Zola. Dr. Tufton, you may take it because I think I've heard you answering it before. Whether black people can get the virus.
Well, in reviewing the countries where the virus is present, I know that there are countries. Well, let me stay in Jamaica. We have 2 Jamaicans who have tested positive.
2 Jamaicans?
2 Jamaicans, yes. They traveled. They picked it up elsewhere in the UK and are now here. So the answer to that question, as far as we're concerned, is that we believe that all should protect themselves for now. I have not seen any scientific evidence. You may see trends as to where it started and where it has spread to, but I would not be prepared, and I don't think any of us should be complacent.
Dr. Bisasor McKenzie, Overdose is asking this question as to whether the virus can be transmitted to pets.
Okay, well, we know that the coronavirus is more predominant in animals, the group coronaviruses, okay? And the thought is that the virus was transmitted from animals to humans, okay? But in terms of humans now transmitting to animals, we don't have that information as yet. And as time goes by, I'm sure information will start filtering in terms of whether pets have become sick, and then testing and that would have done to inform that kind of information being put out globally. But right now we don't have any sound evidence that is saying that. But we know that for coronaviruses, animals play an important part in transmission.
We're almost out of time, but there are a few questions that we have to try to get in. Mo Susu is asking, are pregnant women and their babies at higher risk?
Okay, there was a study that came out of China that looked at about 9 pregnant women, followed 9 pregnant women during their pregnancy. And the tests were done at delivery, on baby, on mommy, and there was no evidence of there being transmission from the mother to the fetus. However, again I say, as time goes by and we have larger cohorts of persons to be able to run these kind of investigations on, I'm sure that more information will become available. But based on that study that was done in China, that review of those pregnant women, there was no evidence of spread to the
Mr. Bryan, you may want to take this one coming from Shelley. She's asking what specific guidelines or recommendations are being given to operators of daycare facilities?
Well, that sounds like a question for the same.
Well, from a business standpoint.
So for daycare facilities in particular that have a large number of children in the environment, the infection prevention and control protocols are critical. Ensure that the caregivers are adhering to the hand washing, the hand hygiene protocols, ensuring that the cleaning procedures for the daycare center are in place, and utilizing the right quantity and quality of product to ensure that cleaning is effective for all the surfaces within the environment. Ensuring also that they take note of the public information that is there in terms of their own operation, whether or not they are still from the Ministry of Education that has responsibility for daycare, that they take responsibility in terms of whether or not they should close facilities once we move into the different stages of the epidemic. But in terms of the other infection prevention control, I would refer to the CMO.
But CMO, is there any special interest now in the parishes of Manchester and Clarendon concerning coronavirus?
We have our contact tracing have led us into Clarendon, so we are investigating some cases. I cannot speak definitively about Manchester at this time, but certainly I am aware of that there were some contacts that were Clarendon.
You said you're almost out of time, and I really have to get this point in, if I may. Thank you. It is important for us to telecast to the country that while this virus should be concerning to all, one should not panic or create hysteria around, you know, the likelihood of overcoming or not overcoming the virus. The truth is that if you look at the data, and the clinician here can verify, the vast majority of persons who have gotten the virus to date in other jurisdictions have recovered, and recovered to normality. In fact, some persons, the younger population in particular, will not even notice that they have the virus. So we have vulnerable groups, and those are persons over 60 with underlying conditions, you know, cardiovascular disease, arthritis, hypertension. Those persons are the most vulnerable. And as it relates to the fatality rate, it is heavily skewed to those numbers. So I say that to say to the country and to the people, to all of Jamaica, that we have to be concerned. Indeed, this is an opportunity for us to reconnect with good hygiene. And so some of those messages are very important, I think. But frankly speaking, having taken the plan to action with all hands on deck, we can and we will overcome this. And that, I think that's a very important message, because there is a lot of panic purchasing, rush on hardware, on stores, you know, retail stores. Pharmacies, price gouging. And those are things that we really ought to discourage. And indeed, if we have to use the law to do that, we will do so, because the government is very concerned about that, even while we try to put measures in place to overcome the challenge.
How many people are now in isolation, Dr. Bisasor McKenzie?
Presently, based on today's numbers, we have 12 persons in isolation, and because some of these would have come out of the contact tracing that
and
we have
all
done.
those isolated are in Kingston, am I right?
No.
They're in other parishes?
Yes, we do have persons
Is
in other
dengue
places.
under control? Because this is a concern that coronavirus may be compounding dengue.
Well, for dengue, I would want to reiterate to the public that we are still having quite a bit of mosquitoes that's are breeding. We're still having transmission of dengue, but I just want to say that our numbers are going down. But we do not want the public to drop their guard. We certainly, as a ministry, have not dropped our guard. We are still carrying our dengue messages. Our dengue our vector control workers are still out there seeking and destroying mosquito breeding sites, and the messages are still out to the population. Take all the precautions with regards to dengue. The numbers are going down, and we expect that they will continue to go down. But if we drop our guard, then we're in problems.
Compounding other issues. Well, I want to say thank you so very much, Dr. Bisasor McKenzie, the Chief Medical Officer in the Ministry of Health, Dr. Christopher Tufton, the Minister of Health, Mr. Dunstan Bryan is the Permanent Secretary in the Ministry, and also we had with us this morning the interim president of the National Parent Teachers Association, Mitsie Harris Dillon. This has been a special Gleaner Editors Forum on coronavirus in Jamaica. I'm Damian Mitchell.